The situation with antibiotic use is that there's been problems with detection of antibiotic residue, so there's a food safety issue around this, and there's an antimicrobial resistant issue which is receiving a lot more focus of late. We have three local partners here in India. It's the Kerala University of Fisheries and Ocean Science, the Cochin University of Science and Technology, and the Central Institute for Fisheries Technology. So the project is looking at smallholder aquaculture farmer intensification. That's the key target group. And the key problem that the project is dealing with is that many of these farmers now have got much more scrutiny over the use of chemicals to deal with disease problems. So therapeutic use of chemicals, particularly if, as is the case for shrimp farming, those products are being exported to third-party countries. So as a consequence, farmers now are becoming much more reliant on a range of prophylactic or preventative health management practices. And this includes, principal group is probiotics, so these are often referred to as beneficial bacteria that are applied in the pond to deal with water quality issues, the water itself and the sludge in the pond, or they can be applied in feed to have a immunomodulatory effect. We're also looking at a whole range of other products which may have bioactive compounds and direct or indirect effects on the immune system. The project is called IMAQulate, which stands for Immunomodulators in Aquaculture. We cover various species groups, and here in Andhra Pradesh we're focusing on shrimp, Lithoponeus vanamei. We've been here for about a week now, and we've been doing some preliminary work, exploring farms in the north and south of the state, looking at outlets as well, tracing the provenance of various products that are being used to prevent disease in these systems. This is a value chain project. The problems may not just be at the pond level, it may be that we've got to deal with problems further up the value chain. So we've been looking at farms and also looking at retail shops selling the prophylactic chemicals that the project is focusing on, and we've been working from north to south to try and understand the variability in the shrimp production systems. And key amongst that variability is differences in salinity, which we're starting to think may have a big effect on the way that these probiotics actually work at the farm level. If we look at detection patterns in the EU, we see that there's been a rapid decline in the numbers of detections, even as the production has increased. The Indian government is also very aware of the problem and are doing a great deal to set up internal regulatory systems and quality control checks before these products are exported. Biosecurity is probably the key constraint to the economic sustainability and the environmental sustainability of these systems. We have here problems with white spot, which is probably the most important disease, but there are other disease problems as well. The project works across 3 countries. In India, the project is funded by the Department for Biotechnology. In Bangladesh and Kenya, it's supported by the Department for International Development, and the UK researchers are funded by the BBSRC.